Millions of women experience pain, difficulty, or a really distinct burning sensation during or after intimacy. And yet, nobody talks about it. It just becomes this silent burden. Well, in this explainer, we're going to change that. I'm a licensed pelvic floor physiotherapist, and today we're diving right into vaginal burning after sex. We're going to cover exactly what it is, the physiological reasons why it's happening in your body, and most importantly, how we can actually treat it. So let's break this down together so you can finally get some real answers. Look at this quote from a real patient of mine. "I thought burning was just something I had to live with. I felt so isolated and confused." Man, that just perfectly captures the emotional toll of this, doesn't it? When our bodies react with pain during moments that are supposed to be intimate, it's so incredibly easy to feel broken or to just assume you're the only one dealing with this. But I want to reassure you right out of the gate, you are absolutely not alone here. And that brings us to our most crucial starting point today. You are not alone. It is so absolutely vital that we validate your specific experience before we even touch on the anatomy or the medical side of things. If you've been silently dealing with this post-coital burning, maybe feeling frustrated or kind of disconnected from your partner, please know that your experience is valid. It's recognized by medical professionals, and honestly, it's something we see and treat in the clinic literally every single day. All right, let's get into the truth about pain. As a physio, one of the biggest hurdles I see is how we've just totally normalized women's pain. While this discomfort is incredibly common, it is never, ever something you should just accept as your normal. Pain is your body's alarm system, right? It's a signal that something needs attention, not a life sentence you have to endure. So let's look at the difference between what's minor and what actually needs a clinical assessment. On one hand, we have occasional, mild irritation. This can happen to anyone. Maybe there was just a bit of friction and the discomfort resolves super quickly on its own. Totally fine. But on the other hand, we have persistent burning. If you're having a burning sensation that lasts beyond, say, 24 to 48 hours, happens repeatedly, or actually stops you from enjoying intimacy, that's a massive, clear signal of an underlying issue that we absolutely need to address. So what's causing it? Let's go over the 6 main culprits. Because, hey, we can't fix what we don't understand, right? Let's figure out what might actually be happening inside your body. But first, quick question for you. Does this sound familiar? If anything we've talked about so far is resonating with you, if you're nodding along thinking, oh my gosh, yes, that's exactly what it feels like, do yourself a favor, save this explainer, and keep watching. The info coming up is going to be a real game changer for you. Okay, let's break down the first 2 culprits. Number 1 is friction and insufficient lubrication. You might notice this if you're going through hormonal changes, like, say, postpartum recovery or breastfeeding, or honestly, even during periods of super high stress. All of those things can cause significant vaginal dryness, which leads to micro tears and, you guessed it, burning. Number 2 is infections. Really common and highly treatable infections like yeast infections, BV, UTIs, or STIs are super frequent causes of that post-coital burn. If you've got any unusual discharge or odor happening at the same time, this is a very strong possibility. Moving right along, number 3 is allergic reactions. Your body might just be having a localized sensitivity to latex condoms, or maybe specific ingredients in your lube or personal care products, which heavily irritates those delicate vaginal tissues. And number 4, this is where my clinical heart lives, pelvic floor dysfunction. When your pelvic floor muscles are overactive, tight, or literally in a spasm, they create an immense amount of painful friction during penetration. It's kind of like trying to force a door open when the deadbolt is still locked. It just doesn't work, and it hurts. And here are the final 2 major causes. Number 5, hormonal changes and vaginal atrophy. Postpartum or menopausal hormonal shifts actually cause a physical thinning and drying out of the vaginal walls. That makes them way more prone to irritation. Finally, number 6, nerve-related issues. Conditions like pudendal neuralgia involve irritation to the actual nerves in the pelvic region, causing this deep, localized, incredibly hypersensitive burning pain that just flares up right during or after intercourse. Pain is treatable. I really want to anchor everything we just learned with that simple fact. Yes, there are a ton of complex causes, from tight muscles to thin tissues to angry nerves. But listen to me. Every single one of those 6 causes has a real clinical pathway for treatment. I want to give you some immediate hope right now. Your body is entirely capable of healing. All right, let's talk solutions and treatments. How do we actually fix this? We know what causes the fire, so how do we put it out and rebuild the tissue? Let's start with some practical steps. Step 1, enhance lubrication. Start opting for high-quality, unscented water-based or silicone-based lubes to immediately cut down on that friction. Step 2 is getting some medical intervention. If you even slightly suspect an infection, go get tested and treated promptly by your healthcare provider. And step 3, manage those allergies. Try switching to hypoallergenic products like non-latex condoms or completely natural lubricants, just to see if that irritation magically subsides. Let's pause for a second because I have another question for you. Have you been trying to just ignore the discomfort? So many women do. They grit their teeth, cross their fingers, and just hope it goes away by the next time. But I really want to gently warn you against ignoring persistent pain. Your pelvic floor muscles are smart. They instinctively react to pain by clenching up to protect you. Over time, ignoring that pain literally creates a vicious cycle of chronic muscle tension and chronic irritation. Early intervention is absolutely key here. And that early intervention, it often looks exactly like pelvic floor physiotherapy. This is a highly specialized clinical treatment designed to release muscle tension, desensitize those irritated nerves, and completely restore proper pelvic function. It is a wildly powerful, highly effective, and non-invasive tool tailored specifically to address the muscular and nerve-related root causes of that burning pain we were just talking about. So, how exactly do we pull that off? Well, as specialized physiotherapists, we use a few core clinical techniques. First, we use manual therapy. That involves very specific hands-on techniques to physically release the tension in those overactive, tight pelvic floor muscles. Then there's biofeedback, which is just an incredible tool to help you actually gain awareness of your own muscles so you can actively learn how to relax them yourself. And finally, we give you tailored exercises designed exactly for your body's unique needs to restore your overall function. Basically, we're just guiding your pelvic muscles back to a happy, relaxed, pain-free state. So here's the bottom line. Relief is absolutely possible. I seriously cannot stress this enough. With the correct diagnosis, a totally targeted care plan, and the right support, women can and do fully return to comfortable, enjoyable intimacy. You absolutely do not have to permanently sideline this part of your life. Which brings us to taking that next step. Look, reaching out for help regarding your sexual health. It can feel incredibly daunting. My goal is to gently guide you toward a safe, specialized environment where you can get professional help without an ounce of fear or embarrassment. And this is exactly where my team comes in. At OVA Women's Health in Burnaby, BC, our physiotherapists specialize specifically in sexual health and pelvic pain. We have had the immense privilege of helping countless women who are experiencing the exact same symptoms of vaginal burning that we've mapped out in this explainer. We deliberately designed our clinic environment to completely lower the barrier to entry for you. We maintain a strict women-only specialist focus. It is a completely safe, incredibly private, and 100% non-judgmental environment. Every single woman who walks through our doors gets an evidence-informed care plan tailored to her specific anatomy and her specific root cause. We treat you with absolute compassion because, honestly, we understand exactly what you're going through. If you're wondering what that very first appointment looks like, it's simple, confidential, assessment-based, no pressure. You'll come in, we'll listen to your story, we'll perform a really gentle clinical assessment to figure out what your muscles and nerves are actually doing. And then we'll just talk about your options. That is the whole shebang. It is entirely at your pace. If anything we covered today struck a chord with you, consider this a very warm invitation. You can go ahead and scan the QR code to book an appointment with us at OVA Women's Health. You deserve to feel better. You deserve intimacy that actually feels good, not painful. Space is kind of limited, but we do even offer emergency appointments if you have urgent concerns. So just scan the code and let's get you on the path to healing. I'm going to leave you with this final thought. Aren't you ready to reclaim your comfort and your confidence? You've got the knowledge now. You know that this pain isn't normal, you know what causes it, and you know exactly where to find the specialized help to actually fix it. Please don't let another month go by living with this discomfort. Prioritize your pelvic health today because your body is just waiting to heal.